It's infrequent that I'll come across a patient who has a really good going clear-cut food trigger, but it does happen. So ones that people can report are oranges, chocolate. Probably the most common would be alcohol, so wines in particular. But we're increasingly with a lot of the triggers for migraine, we're starting to think of it as perhaps more of a prodrome, no, rather than a trigger. So people thought that chocolate and sugar were a really strong trigger for migraine in the past, but we now know that the prodrome of migraine can include carbohydrate craving. So similar to the neck pain, perhaps people are developing a migraine, they get that carbohydrate craving, they eat the chocolate, they eat the sugar, they then develop the migraine and blame the sugar or the chocolate, whereas it was actually part of part of the migraine process that led them to eat that in the first place. That said, I do think that there are some individuals who will find that some foods set them off. I have one patient where capsicum will absolutely set her off, even if it's smuggled into food. But I think it's not as common as we used to think. I also see patients really go down a rabbit hole of keeping extensive food diaries and trying to do these crazy exclusion diets that take up a lot of their mental bandwidth, and I've not seen really positive outcomes from changes in diet. The one dietary factor that is definitely a trigger for migraine is prolonged fasting. So skipping meals is bad news. And people can sometimes notice a real explosion in their migraine if they have changed their diet for fasting for weight loss or for other health purposes.